Hello, so we're back with our series of videos on sleeping better. And a lot of my patients ask me, how do I know whether I should come to get a sleep evaluation? Well, the first thing to remember is this is not just about machines and CPAP and sleep apnea. There are a whole range of different sleep disorders that we treat here at Eastgate Sleep Care. So if you're having a problem with sleep from any kind, come for an evaluation. We can determine on an initial consult what category of sleep disorder that you fit into. I mean, in today's modern life with so many worries, a large percentage of our population has problems with insomnia or other reasons for not sleeping. At least 58%. Women suffer from insomnia more than men because a man's work is from sun to sun, a woman's work is never done. So people who tend to worry or be perfectionists often have problems with their sleeping. So if you feel your sleep is disturbed or you're not rested when you wake up, a sleep evaluation is a good idea for you. There are 88 different sleep disorders, but 3 are the most important. I just mentioned insomnia as a big portion. Another big portion is sleep apnea, which we're going to talk about. Another big portion is restless leg. And by coming to a sleep lab, we can find out which those categories you fit into. Some of these disorders can be simply solved with lifestyle changes. And in another video, I'll tell you about the healthy habits for sleeping. But today, I'm just trying to give you the indicator. If you're not sleeping well, if you feel tired, that's an indicator. Another indicator is your spouse. You know, while you're sleeping, you don't know if you snore. But if your spouse says you snore or you stop breathing, they know. If anybody starts thinking about a sleep disorder, it's highly likely that they have it. Now, we have an instrument that we call the STOP exam, and we're handing this out, and it's very easy to take. If you answer 5 questions, you can pretty much tell whether you have the second category of sleep disorder, and that's called sleep apnea. Sleep apnea is when your neck is closing down at night and it prevents you from breathing correctly. And first you might snore. If it collapses all the way, then you'll stop breathing. And your body doesn't like that, so it sends out all this adrenaline, and they go, breathe, 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 breathe. And if your spouse has heard you do that, or if you've woken up, you pretty much know that you have sleep apnea and you need to be evaluated. Incidentally, treating sleep apnea can extend your life. People with sleep apnea who don't get treated pretty much have 20 years taken off their life. So we like to prevent problems. We like to prevent strokes. We like to prevent heart disease. We like to prevent traffic accidents. And we can do all that and make you feel a lot better too, and have a lot more energy during the day. But again, the focus is, how do you know that you should be screened? Well, we have the 5-question STOP exam. All right, S-T-O-P. S is for snoring. Do you snore loudly? Or ask your partner, do you snore loudly? T, are you tired during the day? O, have you been observed to stop breathing? And P, do you have a blood pressure problem? Then there's actually a 5th question. Is your neck larger than 17 inches? People with a neck larger than 17 inches have a very high incidence of sleep apnea. If you answer one of these questions yes, of the 5 questions, there's more than a 60% chance that you have sleep apnea. If you answer 2, it's up about 98%. So If you have one question positive, think about coming to see us. If you have two questions positive, come to see us right away. Now, what could be easier? I mean, obviously, there's a lot of advances in sleep sciences. We have a lot of new knowledge about the genetics, about what causes it, lifestyle changes. But the most important question for you is, when should you come to see a sleep specialist? And we can make that very easy. If you feel that you have insomnia, come see us. You might not need an overnight study. You might just need to modify your behavior a little bit. If you take the STOP exam, you need to come so we can see if you need treatment for sleep apnea. Well, that's about all. If you have any questions, give us a call. We have these cards for you to look up, and there's another portion on this web where you can take the test, and I'll be happy to see you. Thank you very much.